And next on the list is Dr. Westbrook Weaver, President and CEO of Tempo Therapeutics, another UCLA company working on wound healing and aesthetic applications.
All right, well, first I'd like to thank everybody for being here. Thank you, Ahmed. This is a great opportunity for us. And so far from the great talks, Emma and John both. My name is Westbrook. I am the co-founder and president of Tempo Therapeutics. Don Griffin is my co-founder right here in the front. You met him earlier when we all introduced ourselves, which I actually really enjoyed that. It was nice, makes it feel very personal. So a little bit about myself. I'm originally from Alabama, and I moved out to Southern California to go here for grad school, and I don't think I ever want to leave. So Don and I recently developed some technology in our postdocs here at UCLA, where this company that we've just founded, Tempo Therapeutics, is based off of this technological platform. So we're a company that is centered around a new type of biomaterial that is geared towards accelerated wound healing and tissue regeneration, ultimately to be able to regenerate tissue without forming a scar. And so our avatar here is the salamander, which is able to regenerate its tissues, and also tempo, because time is very important in wound healing and tissue regeneration. We think we have a good grasp on control of that time. So one of the main things where we are focusing on right now is non-suturable and chronic wounds. So basically wounds on the epidermis where you can't use sutures to close them up, or are too large to be able to effectively put a bandage over. So specifically, tissue grafting and advanced bandaging are basically the standards of care for both burn and chronic ulcers right now. But it's pretty costly to healthcare payers and typically pretty poor outcomes. Also, another thing that we're very interested in is what's called Mohs surgery. So basically, if you have a skin cancer and you get that skin cancer resected, you leave a very large area which is open. And in about 55% of those cases, the clinician basically puts a bandage over it and relies on normal wound healing to occur, which takes an extremely long time and requires bandage changes every day. Very difficult for both the patient and also for the clinician. So in general, there are some strategies for using biomaterials-based approach to treat these types of wounds. There are two very important things that are required there, both the ability to let tissue grow in and also the ability for that material to be injectable, because every wound is a different shape. And you can't know ahead of time what that shape is, so injectability is very important. So I have here on the bottom some sort of images, actually courtesy of these two guys, Nick and Rob here, Lux Virtual. They're very nice gentlemen to help us out with this. So basically, if you have a wound that's any shape, if you have a material that acts like a liquid, you can inject it into that or apply it to that. It takes the shape of that and actually forms a very nice seal around the wound. But what happens right now is all of those materials actually end up inhibiting wound regeneration or tissue regeneration because they act like a solid block afterwards, where they form like a jello. So that's basically the sort of standard of practice for advanced wound care through biomaterials-based approaches. And so basically, what we have done is invented a new way to make a material that allows the porous material the injectable material to also contain a microporous network. And that's very important because that microporous network allows the normal tissue to grow into that material without having to degrade it, and then can degrade it from the inside out. So that allows tissue healing to occur fast, hence the tempo. And the quickness allows you to avoid inflammatory or excess inflammatory response and actually end up regenerating tissue rather than forming a scar. So we're really interested in pursuing this for both burn wound treatment, chronic ulcer treatment. Obviously, as I think it would be a great example of a new type of tissue filler, where actually it wouldn't be a filler, right? It would be a scaffold for your normal tissue to grow into, and instead of just being a filler that would have to be injected over and over again, would actually allow you to grow new tissue there. So I don't think I need to tell people that burn injuries are serious and very common and costly, as well as chronic wounds. We're talking about really large markets here with really high cost, both because of surgical costs are high, intensive care cost is very high. So people that are presenting with greater than 30% total body surface area burn wounds are very difficult to treat. And we think that Tempo Therapeutics has a biomaterial that will be very effective in treating those types of wounds. And ultimately also chronic wounds, a very large market. I mean, the diabetic market is growing and very difficult to treat. And one of the things that Tempo can help with is not necessarily the systemic treatment of the diabetes itself, but at least the treatment of the acute wound that is sort of resultant from the peripheral neuropathy caused by the diabetic patient. Which are both, we're talking in the like billions of dollars per year just in the US alone. So our goal is to use this new platform, which is based upon the way that we make the material, not the chemistry of the material itself. So one important thing is you can use polyethylene glycol, you can use naturally occurring polymers, and it's all about the way that you geometrically fabricate the material, which is what our IP is centered on. And we want to develop this to improve the efficacy of burn treatments, chronic ulcer treatment, Mohs skin cancer resection, and also ultimately develop it as a use as an aesthetic medicine as well. So then to do that, we will bring to market this fundamentally new approach. So the idea is that rather than having a non-porous material, you have a porous material. And that is what the IP is centered on, which is super important for us because it allows us to go into all these different markets utilizing the same type of technology, which we allow our material to mold to any wound shape, bond to the tissue material interface, and ultimately encourage fast tissue ingrowth and regeneration without that enhanced immune response. So things that are out there right now, especially if we're talking about diabetic and burn ulcers, there's companies like 3M, who everyone knows about, who's very up there in terms of wound dressing. So the Tegaderm is a wound dressing that basically just covers the wound and hopefully keeps bacteria out. There's a little bit more developed things. So Convatec has this thing called the Aquacell foam dressing, which is actually really interesting. It has a hydrogel built into the dressing that just absorbs the exudate from the burn wound, which actually has been shown to keep down infection and help healing, but it doesn't actually incorporate into the tissue and doesn't itself promote regeneration. I think the closest thing that would be to regenerative capacity is this graft jacket here, which is basically their IP is centered around if you take a piece of tissue from a pig or another human, they have IP based around how you can cryogenically preserve that and decellularize it to then use later. So that would be more like the regenerative capacity, but at the same time, that's not an injectable material. So you have to literally cut it to be the shape of the right wound, and it does improve efficacy, but it's very difficult and extremely expensive. So where we fit in here is on the right, where we basically have a high wound resolve rate. Our material cost is low because it's fully synthetic and we don't have to get it from any naturally occurring products. We have high regenerative capacity, and we've seen this in many mice studies already, and ease of application because we have a material that we fabricate pre-hand, store it, it gets stored on the shelf in the pharmacy, and the clinician orders it and then pastes it onto the wound. So our development strategy, as I said, is these three main categories here, which is large area burns, post-op treatment for Mohs surgery, and treatment of diabetic foot ulcers. One thing that we're really interested is developing some partnering strategies with the wound care market because the market is large and there are a lot of big players there, but the market is pretty well spread out between a lot of different companies, so I think that partnering strategies might be a good way to go there. And then also licensing out the use, since we have a platform technology, licensing out the use of this in specific applications would be a pretty lucrative strategy. So right now we are pursuing seed funding and also government grants. We're pursuing a lot of SBRs right now for scaling up our gel production and then also moving into large animal models. So we've done a lot of studies in mice that show really good efficacy, so then we need to sort of move into larger animal models to actually pursue ultimately an FDA approval, which I think would be more like through a 510K pathway, since we're not actually adding anything that's doing anything to your body. It's a fully synthetic material. So we have intellectual property, so provisionals filed through UCLA, and we've entered into intent to license agreements with UCLA. I'll just end now with a little bit about us, so you know myself and Don now. We have two scientific advisors and co-founders, Dino DiCarlo and Tatiana Segura, who are both professors here at UCLA, and currently two consultants, one Dr. Scumpia, who's a dermatopathologist at UCLA, who Emma might know, and Dr. James Dunn, who's the chief of pediatric surgery at UCLA, who's advising us a lot on the use of our gel in the treatment of soft tissue surgeries. And with that, I'd like to thank you all very much, and hopefully we can talk later.